So let's come back, right? And let's say a patient with 1.3 breast cell thickness melanoma, no ulceration, and you did the lymph node. So let's say found the arm and you did the lymph node biopsy and it was negative. So at this point, the patient remained as stage 1 disease. That's fantastic. You don't have to do anything, follow up routine basis with the dermatologist, with you, and get the scar checked. And that's one course of direction. Unfortunately, let's say if a patient, you did this procedure, they find the lymph nodes positive. Now at this moment, they got upstaged from stage 1 to stage 3 at this moment, right? Because they have lymph node involvement. What do you do at this point? And do you, a surgeon at this point, still proceeding with complete lymph node dissection, or this is at this point obsolete?
A lot of this has changed, especially over the last 2 decades. The understanding, I think, probably the biggest advancement is the better understanding of this disease. In the past, we probably thought of the cancer, of melanoma, cancer in general, as a cellular process. But in reality, it's a supracellular process. The sentinel lymph node provides us information of the patient, not just the cancer itself, which means that, and what I'm getting at is understanding that cancer and melanoma in specific is an immune disease. So if this is true, and it's not just a cellular process, then trying to take away the patient's disease with surgery is probably not a prudent approach. So I don't do a lymph node dissection on everybody. In fact, I think it's probably not necessary. And that's really based on a tremendous amount of data that we've acquired.
I'm going to interrupt you for a second. Before we even jump into the data, can you just describe when you say lymph node dissection, and I use the word complete lymph node dissection, can you just describe what this procedure is?
A lymph node dissection, in contrast to a sentinel biopsy, is removal of all the lymph nodes within the lymph node basin. So if we're talking about the neck, a sentinel node that was positive in the neck, in the past, we would do a radical lymph node dissection or a modified radical lymph node dissection, removing all the lymph nodes or as many of the lymph nodes in the neck as possible. Because in the past, we felt that this was the only way to cure the patient of disease, trying to get to the furthest extent of the disease so that there's no progression of disease. And we found that really the data doesn't support this. And this is based on a tremendous amount of data that we've acquired from multiple studies. With respect to other lymph node basins, such as the armpit, the same thing, removing all the lymph nodes to try and acquire a surgical cure. And then same thing with the groin, doing a lymph node dissection of the groin, meaning removing all the lymph nodes within the groin. However, knowing that now it doesn't seem to affect cure, it doesn't seem to improve survival, we don't do lymph node dissections when we have only occult disease. And you mentioned occult disease as having microscopic disease within the lymph node. It's not palpable and not seen on imaging. In fact, we find that doing a lymph node dissection in these patients probably just worsens their outcome because they can develop problems with lymphedema, swelling of the leg, extensive swelling of the leg, or wound problems after a big surgery. Instead, we think that it's better to use this data to generate a better treatment algorithm, such as immunotherapy, utilizing medication to treat these patients who have more advanced disease. That's a different way of thinking of how we treat melanoma. Instead of thinking of it as a cellular disease, we think of it more as a supracellular disease. Cancer cells are affecting our immune system or another system of the body that allows the progression of the cancerous cells.
So just to summarize, I mean, I think the current state is we don't really proceed with complete lymph node dissection because the data and all this MSLT trials, etc., come out to show that there's no improved overall survival, number one. And in addition, when you proceed to remove all the lymph node, you have complications like poor wound healing and lymphedema, and especially in the groin area, right? And especially considering that we have all these new immunotherapies, and also plus everything you talked about, this is less of a cellular disease, but more of a molecular and more of immune process that we can leverage immunotherapy or targeted therapy to treat this advanced stage of melanoma.
Right. Right.